Bear with me now.
No problem.
Alrighty, and then I go in here. All right, Dr. Tammy. Thank you for being here with us today. It's always such a pleasure. I know you are on the road, so super, super grateful you were able to make the time to hop on with us. Everybody, I'd like to present you with Dr. Tammy Allen. She is the CEO of TravelMeds2Go. She's also a trusted Fine Fettle partner here in the state of Georgia. Aside from here, though, again, she's the CEO of TravelMeds2Go, so she's all over the place. I'll give you the floor, Dr. Tammy, so that you can introduce yourself.
Hi, everyone. I'm excited to be here today. Just coming to talk to you a little bit about how to navigate travel medications while you're on vacation. And of course, this is kind of the time of the year that everyone's gearing up to travel. And I know you have lots of questions about um, how do you travel with those medications, and can you take your medical cannabis with you?
So, Dr. Tammy, who is this applicable for? Travel Meds to Go. Who can be, benefited from your service?
So anyone really can benefit from this service. We're especially good for people that are traveling internationally, so that you can get those international travel medications such as anti-malarial medications, medications to treat travelers' diarrhea if you get that. But we're also available for local people. If you're traveling domestically in the United States, let's say you forgot your medication, you forgot to take it with you, and you're in a different state, and your primary care physician is not in that state. So we're here to provide medications for you as well. We do one times prescription refills. You can do that up to 3 times a year. Let's say you're in between doctors as well, and we can take care of you there. But we really like to help those people that need those medications for traveling. Let's say if you're traveling domestically and you go to remote areas, you're going backpacking, camping, you're getting off the grid, and we can help you with those medications. And the key here is preventative. We want to make sure you have things to prevent problems in the future.
And what inspired you to start this type of service?
I'm an avid traveler. I've traveled all over the world, every continent except Antarctica, and that's on the list, the bucket list.
The Drake
And
Passage awaits you.
pardon me?
The Drake Passage awaits you.
Yes, but my husband does not want to do that passage. So we're thinking about that fly and go, but we'll see. But because I love to travel so much, I over the years I've been doing a lot of research and trying to figure out how to get those travel medications, because a lot of the family medicine physicians and a lot of your primary care physicians don't necessarily want to prescribe those medications, just because it's not something that they may be comfortable with, especially like malaria prevention, because we don't have malaria pretty much in the US. That's how I got interested in doing this, just because I saw a need for my own self. And then travelers started telling me their stories. And so that's how I got here.
Well, that's awesome. I think, especially when it comes to traveling domestically, right? You don't realize that there are some things you may need. If you're just going from Georgia up to Oregon or whatever the case is.
Right, right. One of the biggies is altitude sickness. Coming from a lower altitude to someplace like Colorado, people don't realize how much trouble you can get into, especially if you already have lung issues like asthma or COPD. I actually was working out in Albuquerque, and I discovered that although Albuquerque is around the 4,000 feet range, that people that come from those like 1,000 feet altitudes really struggle when they come to a place like that if they already have pre-existing lung conditions. So
That's good to know. And especially when we're talking about cannabis, also, right? And understanding how these different states domestically also have cannabis programs, right? So,
yes.
how would you recommend somebody may possibly go about integrating that as they're traveling to a state where they are able to get access?
Right. So I would tell them that they need to research the laws in that state to see if their medical cannabis card can be interchanged, can be used in those states. That's number one. Number two, although these different states have their laws and rules about cannabis, there is a federal law that still has cannabis listed as a Schedule 1, so it's still considered illegal. So you can't transfer it on a plane. So anytime you're taking cannabis between states, you run the risk of getting in trouble. But if that state has a card program that's reciprocal, then you can get your cannabis once you get to that state.
Okay, that's awesome. And I think a great highlight there is Georgia, right? We do accept out of state cards. So if
Yes,
you are traveling from Colorado, whatever the case is, although you may not be able to bring your stuff with you, you can pop into one of our local dispensaries and be able to still purchase, which is great. Um,
absolutely.
what are you seeing are like the most typical requests from patients when they're reaching out to you to get this process started with TravelMeds2Go?
Yes. So I have a couple of biggies. One is anti-malarial medication. A lot of people traveling to Central and South America, parts of Africa, parts of Asia, especially South East Asia. Those places typically have malaria, so you want to be prepared for that. The other thing that's big is travelers' diarrhea. Um, if you've ever gone to a new place and eaten new food and gotten traveler's diarrhea, you know how much that can disrupt your travels. So that's a biggie that I see. And then the other one, motion sickness prevention. Whether you're driving on a ship, all of those things can potentially cause motion sickness. And so that's something that I provide as well.
That's awesome. I suffer terribly from motion sickness, and patch has saved my life.
Yes, that patch. I like that patch. It's not for everyone, but if and that's part of visiting a service like mine because I am a board certified physician. So I'm going to look at your other medications and I'm going to make sure that your medical problems, your medications are not going to interact with anything that I provide for you.
And that's a huge call out there. Anytime you are consuming any type of medication, everybody, it's super important, whether it's something that you would consider more natural, like cannabis, or a prescription, you need to make sure you're talking to your board certified physician so that they can give you the details on how this may interact, because there is just certain
Absolutely.
we don't know. What would you, where are some, so those places you called out, Central America, Africa, stuff like that, would you recommend anytime pretty much you're going international that you meet with a physician, or like what would you recommend?
I do, especially if you have medical problems. So what I'm finding is that my 18, 20-year-olds, they feel invincible. They don't think they're going to have any problems. So they tend to ignore my services, but it's really important for them as well because people just don't realize how prevalent malaria is in these places and it's preventable just by taking this medication before you get started on that trip. So, but if you have any type of medical problems, it's especially important to visit your travel health specialist to discuss potential problems, because we can talk to you about not just your medications, but potential problems at the location that you're going to be in. So, as I said before, it's all about prevention. We want to prevent a problem because no one wants to be stuck in a hospital or trying to find an urgent care or a clinic while they're in another country, and especially if it's in another language.
100%. Do you have any stories you can share of how this has impacted people in the field and how maybe you could have taken preventative care that you just don't know until, hindsight?
Absolutely. Well, I have my own stories.
Yeah.
And fortunately, because I've always traveled with medications, I've avoided a lot of problems. Traveling to Mexico, I was there for a month and no problems. And that last few days, I ate something. It didn't agree with me. I had horrible traveler's diarrhea. So my antibiotics were definitely a godsend. And also, my husband and I, we were on a trip to Madagascar. And we tend to travel off the beaten path. We like to mingle with the locals and get out in the countryside. And so we were on this back road tour, and we arrived in this village that was probably like we had been driving for about 4 hours and saw nothing. So we were out there. And when we came into the village, we heard all this buzzing, and we got out of the car and we saw all of these flies. It was like this mass of flies, swarm of flies everywhere. It covered all the food. And we knew we were going to be sick. But we in the middle of nowhere. We've got to eat.
Mhm.
So we ate, and we were gracious, and of course we were extremely sick. And if we had not had those antibiotics, we would have been in trouble because we were still traveling. We were backpacking in the forest. And so we were really away from any medical care. And if we did not have those antibiotics, I don't know what we would have done, because we could have potentially had to interrupt our trip. So that preparation was really good.
How far in advance would you recommend? I guess, does it depend on the trip that you're planning? What would you recommend that process looks like if somebody wanted to get the ball rolling with you?
Yeah, I recommend at least 3 to 4 weeks in advance. What I find is a lot of my younger people will come to me a day or two before and say, hey, I need such and such medicine. So, ideally, you want to get started with the anti-malarial medication, depending on what it is, at least a couple of days beforehand. But, sometimes we can't get ideal. But that's why I recommend at least 3 to 4 weeks, because the other thing is there are vaccines that I can't provide because I am an online travel health clinic. So injectable vaccines, of course, I can't provide, but I can tell you what you need. If you go to the CDC website, there's going to be this whole list of medication vaccines that they recommend. And some of them just aren't, you don't need them. And that's the beauty of a travel health advisor who can tell you, yeah, I really think you should get this. No, you don't necessarily need that Japanese encephalitis vaccine or, so definitely 3 to 4 weeks, because it takes that long for some of those vaccines to kick in.
Okay. And then how do you go about, I guess, staying updated with all of the constant changes depending on where somebody's going?
Right. So I do a lot of CME, continuing medical education. I am a part of the International Society of Travel Medicine, and they send out information on a regular basis. I I still use the CDC to look up things if I have questions. I also belong to different I wouldn't call it a travel website. It's specifically for people that travel, and for professionals can look on that site and get some information to provide to their patients. So those are some of the ways that I keep up. And then of course I travel, and I learn a lot of things that way as well.
What would you say are some common misconceptions of trying to just like travel with no preparation based off your experience, based off other people's experience? What are biggest tips?
So the biggest thing is people really don't think it's going to happen to them. And as I said, I've had several episodes of things happening to me while I travel, but I have seen really bad things happen to people while they travel. So I also recommend travel insurance. If you're leaving the country, I don't care how old you are, you should have travel insurance.
Mm.
Travel insurance is relatively inexpensive. If you have a $20,000 trip, you've invested all of this money. What's 10% of that to make sure that you have, your health is taken care of? But I recommend travel insurance for everyone. People don't think about that. And also just to think about the things like malaria prevention that they don't think about. They plan this wonderful trip to the rural areas of Thailand, and they're like, oh, I didn't know I needed malaria prevention.
It's a great follow-up. I
and
think a lot of
and
people think of that.
yeah, and then the other thing is that people don't think about is when you're traveling, carry your medications in your your carry-on bag. And
Mm.
I don't mean your carry-on suitcase. You put it in your backpack, you put it in something separate, because you know how we get to the gate and they say, oh, you can have free baggage check.
Mhm.
And people don't think about it. They have their carry-on and now they're going to check it, and now it's under the plane and it gets lost. It doesn't make it under the plane, and then you are there with no medications. And when you get to other countries, there's no guarantee that you're going to be able to get the same medications that you get here in the US, or that it's going to be the same quality, because there's a lot of counterfeit stuff out there.
That's a good call out. And then are you able to guide people on, like, depending on what country they're going to, if they can bring certain medications in?
Yes, that's the other thing people don't think about. We take for granted here that we can, use our Percocet and Vicodin and those narcotics for pain. In a lot of countries, those are totally illegal.
Mhm.
Some countries, you have to have a form completed before you enter the country and get permission that bring those medications with you. And then there's some things that are over the counter, that we think is great, like the Sudafed. And you go to another country and they're like, no, that's not legal here. And they can, one, take it, but two, lock you up if they choose. So I definitely advise people on what they can and can't take if they're on those medications.
Totally. And I mean, just like you said earlier, right, the same applies to cannabis. It's super important that even if you are a medical patient, you understand the laws of where you are traveling to. So,
Yes.
what would you recommend to somebody who maybe doesn't rely as heavily on, like, traditional prescriptions? Maybe they have transitioned to a little bit more of a hybrid style of
Mhm.
medication. What would be your recommendation to them?
And those people in particular, those types of travelers need to consult with a travel medicine expert, because I see all the time people just take it for granted that what they do in one state they can do in another state, and that's not necessarily true. So it's really important, especially if you're into more natural medicine, and more holistic medicine, to talk with a travel professional about what things you should or shouldn't take with you across state lines.
Absolutely. As an example, everyone, here in Georgia, we are still under the low THC oil program, which means that if with your medical card, the products that you're purchasing from the dispensaries are 100% legal under state law. With that being said, if you are coming into the state with other products, Even if you have your out-of-state card, let's say you have flower or vape, things along those lines, you can still find yourself in a bit of a pickle because of our local regulations down here in the state.
Absolutely. I'm glad you said that. I had forgotten about that, but that is absolutely true. All cannabis is not created equal.
100%. Not all regulations aren't created equal, huh? So,
That's absolutely.
and so we can do a quick, brief overview of what the program looks like in Georgia. It's pretty straightforward. I mean, for the most part, it operates similarly to your telehealth setup as far as having your virtual
Mm-hmm.
appointment with a dedicated board certified physician. You're going to be asked a bunch of questions related to why you think cannabis is a necessary, medication, or what you're struggling with to be able to help you determine, do you qualify for this? Because again, only a physician is going to be able to tell me, hey, you're on blood thinners. This is probably not the best option, right? And so after you are qualified for the state, they will be mailing you your card, which is a huge benefit if you do live in more rural areas, which is the next piece that I want to get into with you, right? On how people who live in more rural communities, how have you seen, them benefit from this?
Yeah. So anytime you're using telemedicine services, of course, there's this convenience going on. You don't have to leave your home. You just get on the phone or video. And in my case, my company has asynchronous telemedicine, which means that you fill out an interactive online form, and you don't, if you don't want to speak to me, which is a lot of my younger patients, then you don't ever have to speak to me. We text back and forth. If you want to talk to me on the phone, you most certainly can. I love talking to people about their travel. But when you're in a rural area, those services are really important. And I just can't speak enough on how convenient and important it is to have travel medicine or to have any type of telemedicine for people that are in those more rural areas. And especially if you're older. And of course, if you're older, you tend to have more medical problems and more medications. So you really will benefit from someone that you can talk to about those things. And you don't have to leave your living room or your bedroom.
And then once let's say we set up an appointment, Dr. Tammy, I do have my conversation with you. I let you know, hey, we're planning on going to Thailand. Give me the rundown. Where would I actually be able to go pick up my medicine?
You would pick it up from the pharmacy of your choice. So you let me know, you will have let me know in the questionnaire what pharmacy you prefer. And we can do mail order pharmacy, we can do your regular around the corner pharmacy, any place that accepts electronic prescriptions, which is 99.9% of the US pharmacies. And I send it there electronically. So you just go pick it up when it's ready.
That's awesome. And then since launching here in Georgia, Dr. Tammy, what have you been most surprised about?
What have I been most surprised about? That's a good question. You're stumping me on that one. I guess just the fact that people, because I take it for granted, I know so much about medicine and medications. I take it for granted that everyone knows not to take cannabis across state lines. And so I guess that's been a little surprising that, people, they don't know. They do it here. They assume it's okay everywhere else. And the same with their medications. And so I think probably that's been the most surprising thing for me.
How are you spreading the word about TravelMeds2Go, and how can partners like Fine Fettle help you get the word out?
So I am spreading the word multiple ways, through webinars like this, going on podcasts, doing Google Ads, on social media, and just word of mouth. I get a lot of business word of mouth, so that's great. And I've done a few TV interviews, so just
We saw that.
any way I can get my message out there.
That's amazing. No, it's a necessary thing, right? Most people, like you said, when they do finally get the opportunity to go somewhere, the last thing you want to worry about is your health. So
Absolutely.
having that handled is just such a relief. It's a very necessary service you're providing to the community. So thank you on
Thank
behalf of the community.
Well, I thank you for allowing me to tell my story here.
Absolutely. I guess my last question for you is like, is there like any particular trend that you're seeing or any big recommendation on if are you seeing a lot of people travel to a certain place that you're noticing maybe, oh wow, a lot of people don't think about, so and so or whatever the case is. What would be your last piece of wisdom to people who are getting the travel bug, have been doing it for a while, or just a reminder?
My biggest thing is that people tell me all the time, "Oh my goodness, I didn't know I needed anti-malarial medication for this destination." So I think that's a big one.
Mm,
The other thing, even though I can't do anything to prevent it, is that measles vaccine. Make sure you're up to date with measles vaccine, because measles, it's out there, and when you travel internationally, you're definitely exposed to measles in most of the places you go. And so, who wants to come home with measles or not come home with measles, because
great.
it can be a pretty serious disease, and it's preventable with those vaccines.
No, great to know. And then what are your upcoming travels?
So I have some local trips planned. I'm going to the beach for my birthday in North Carolina. Aruba with some friends for a birthday, and then my family and I take a big trip at the end of the year. And I've been to Thailand before, but they've never been to Thailand.
Mm,
So we plan to do Thailand and see what other countries we can hit on our layovers.
yeah, that's how you do it. And then how are you preparing for those trips? Is there anything particular for each of the legs? Anti-malaria for sure for Thailand, I would imagine.
And anti-diarrhea. Definitely. But that's about it. I make sure my family knows which vaccines and medications they need, and we just go and have a ball.
Well, that is so awesome, Dr. Tammy. Can you let the people know how they can find you if they're needing your services? What's the best way to reach out to you, get in touch with you, stay up to date on anything upcoming with TravelMeds2Go?
Yes, so they can visit my website, www.travelmeds2, the number 2, go, travelmeds2go.com. I'm also on social media. I'm on Instagram and Facebook with the same TravelMeds2Go handle. And you can find me on LinkedIn by looking up Tammy Allen, MD. I'm pretty active on LinkedIn as well. I'm trying to think of. I'm on most of them, but I'm most active on Facebook, Instagram, and LinkedIn.
Okay, awesome. Well, thank you always, Dr. Tammy, for being such a wonderful partner and advocate and supporter of Georgia's Medical Cannabis program, um,
Absolutely.
currently known as the low THC oil program, but we're, one day at a time. So proud to see all the movement that you're making with Travel Meds to Go and getting people educated on like living your best life, but preparing yourself in advance.
Absolutely. Thank you so much.
Well, you have a great rest of your evening. Thank you guys so much. And we will see you soon.
Bye, everyone. Thank you.
All righty.